PEDs, or performance-enhancing drugs. Do you need to take them? Should you take them? Should we even be talking about them? We're going to deep dive today into all things related to performance-enhancing drugs. As always, I'm joined by my good mate and fellow host, Scotty Goebel. Scotty, welcome.
Thank you, Luke. I'm looking forward to this discussion. We've got some interesting talking points here to go over today.
Mate, it's a bit of a controversial topic for sure. Now, just on the outset, we're not giving any recommendations about dosages. We're not saying you need to take PEDs. This is for entertainment purposes only. Scotty and I are not medical professionals, and we are certainly not encouraging you to take any sort of drug, but they are in sports, particular bodybuilding, and so we want to cover them here on Muscle TV. Scotty, I guess the first thing, mate, to start off, and this is my overall view, but do you need PEDs to get massive? Short answer, no. Longer answer, maybe, depending on the goals that you want to achieve. How does that top-level summary sit with you, mate?
Well, I probably have a different definition of massive than the everyday person on the street. Massive to me, I picture a huge professional bodybuilder. And as a general rule of thumb, you need to be on PEDs in order to get to that level. But to the average person on the street, they would consider, you know, a 6-foot man who's, you know, probably 95 kilos and around 10% body fat to be, you know, fairly massive and muscular and certainly stand out from the everyday population. If your goal is to look very, very different to the average person on the street, you can absolutely do that naturally, or certainly for the vast majority of people. There might be the genetic outliers that potentially can't. Much in the same way, there are genetic outliers that can get bigger naturally than some enhanced people can. So there is that individual variation. But I would say if you want to just look fantastic at the beach, stand out from the everyday citizen, you don't need PEDs, no.
And mate, I completely agree with that 100%. So let's say you are the everyday person who's just going down to the beach and maybe they're kicking off for the first time. They've been training for a year or so. They're seeing other people in the gym put on heaps of size and they start to wonder, you know, can I do it myself? You mentioned a few factors there, one of them being genetics, but the other being, the effort that you're willing to put into your training and your nutrition. So let's say someone who, again, is going for that beach body look and they're a bit curious, you know, do I really need PEDs to take things to the next level? Would your overall advice be, no, you don't, give it a bit of time? But like you said, if you want to go to that extreme case, it's a completely different ballgame.
Yeah, absolutely. Like it is a time thing. Muscle doesn't come on fast no matter how you go about it. So if you do need to put in work and you do need to stay consistent with your diet, you do need to have a lifestyle which is conducive to recovery and muscle growth. So you need to apply the most important factors of bodybuilding: nutrition, training, rest, recovery, if you want to get massive, regardless of you taking PEDs or not. So in most instances, yes, I would say you should just spend the time in the gym. And I'm a big believer that if anyone jumps on PEDs, they should do so with a fantastic natural foundation in place. So I would always encourage people to put in a minimum of 3 and preferably 5 years of good, consistent natural training, where you still won't have reached your natural genetic potential before you even consider it. Because at that point, at least when you do get on, if you go down that path, you will have laid those foundations, you will have established good training practice, you'll know you're nutritionally disciplined, and probably most importantly, when you come off PEDs in the future, which you will inevitably have to do at some point, you will most likely continue training. And that's one thing that I've seen in the gym culture at times, where you might get a young bloke who comes in, trains for a few weeks, his mates tell him he should get on gear, he jumps on PEDs, he gets some fantastic results for 3 months, he comes off them, he loses all motivation, he loses his appetite, his recovery's terrible, he's regressing in the gym, he hasn't laid the foundations, and he just stops training and stops eating and he loses absolutely everything. So I think it's very, very important that you have that consistency first before you go down that path.
100%, 100%. And I guess another big consideration too is your age, because look, we all remember what it was like to be in your early 20s in the gym. You want to get massive overnight. Like there's the pull to be as big as humanly possible and be as strong as you can. But the thing is, when you're that age, your testosterone levels are the highest that they're ever going to be in your whole life. You have the best hormone profile, probably the best overall metabolic profile. really, it is the absolute ideal time to be training naturally, but it is also probably one of the most difficult times when you are being an aspiring bodybuilder because everyone's bigger than you, everyone's stronger than you. You want to get to that same level. You know, you feel like you're sort of underperforming a little bit if you're not. And so I guess there's that real dichotomy of making the most of my natural hormone profile versus getting as huge as I can, as young as I can. Is that a consideration that you consider important, Scotty? Is, you know, the overall age of the person, especially a male, peak testosterone levels, early 20s?
Yeah, I would think so. Absolutely. You certainly don't want to be taking steroids before you've reached true sexual maturation, which for some guys is at, 18, 19, and in rare cases even, 20 years old. So you certainly don't want to be taking before that. And like I said, if you're going to lay a foundation of, 5 years of good, hard, consistent training, unless you're starting at 14, 15, I don't think you've got any reason to be jumping on at such a young age. And I'll just in general discourage everyone from getting on when they're really young, because they should be able to grow naturally. They just should. And if you can, you should. I don't know. That seems pretty logical to me. So, I think age is a serious consideration, for sure.
Nice. And so let's get into, I guess, the different classes of PEDs. Now, I've sort of made my own little 3 classes here, and feel free, Scotty, to jump in if you agree or disagree. But the first is that they're legal and they're allowed in tested sports. The next one is they're legal, but they're banned in tested sports. And then finally, they're illegal and they're banned in tested sports. So first things first, are you a natural athlete if you are not using substances banned in natural sports? Or are you a natural athlete if you're not using any drugs at all? Panadol, caffeine, Nurofen, non-steroidal anti-inflammatories, you name it. Like, what's the line in the sand? Because often, natural people who say they're natural, they really hold themselves at a very high standard. And I understand what they mean, but what is it? Is it I'm not using any drugs, or I'm just not using drugs that are banned in tested sports? And we're relating this to bodybuilding.
Well, there's the philosophical answer, and then there's probably the legal answer, I guess. But I would suggest if it's not on the ban list, then you're totally fine. Now, this has led to a number of natural competitors trolling through the ban list over the years, looking for loopholes and things they could take. And for a while there, they were pounding down thyroid hormone and yohimbine hydrochloride, which I don't know that yohimbine hydrochloride is still yet on the ban list. And under which case they very happily declare themselves to be natural. I don't know what they do if it's then shifted to the banned list. Are they no longer natural? For me personally, look, it's a very pedantic sort of grey area, but for me, it has to be listed as a banned substance, whether you hold up WADA as the governing body or not. Is, I guess, an individual choice, but it would be banned within your particular sport. Then you are no longer natural in my eyes. So I would hate to see someone get taken out of their chosen profession or pursuit just due to having taken some, Panadol or something along those lines.
And so that would fall in the category of legal and allowed in tested sports, say your caffeine, Panadol, Nurofen, that type of thing. Legal but banned in tested sports. I mean, it could be something like your asthma medications, different diuretics if you've got them on script, insulin if you've got them on script. I know cold and flu tablets as well. That would sort of fall into that category. And then we've got the illegal and the banned in sports, which is your, I guess your traditional anabolic steroids that most people would think about, like testosterone derivatives and that type of thing. So I guess, one of the things, Scotty, they're banned because if you are taking PEDs and you're in a tested competition, you have an unfair advantage over your competition. There is no question about that. Do you feel there's an argument that could be made in the untested federations that in some ways it evens the playing field to some degree, because all the top level competitors will potentially be in the same ballpark with what they're doing? There'll always be extreme cases, but it just takes away then that disparity between someone who is natural and someone who is not natural in a tested federation.
I think we're very, very lucky in bodybuilding because we do have both options. And I think it should be there is a level playing field for both. So if you're competing in tested bodybuilding, you're on a level playing field with people that haven't taken banned substances. And if you're competing in an untested federation, then that's also a level playing field because everyone can take all the same things. So I think as long as we follow the rules, everyone's on the same level. And it doesn't give anyone an unfair or fair advantage. It's just purely comes down to then all the other variables: genetics, hard work, consistency, time, etc. So yeah, I think you can make the argument that it levels the playing field if you're untested and everyone else is also.
What do you think of the drug testing routines in natural bodybuilding, Scotty? Do you think that it's just a bit of a label or a sticker to put on the poster of your show that you're promoting, that you drug test, but you don't really do it at all? Or do you feel that it should be anyone who places in the top divisions need to be drug tested? Like, if you want credibility, if you want to genuinely stand behind the federation and say it's tested, I know there's expenses involved with the drug testing and there's the coordination of doing it on the day, but you know, what makes a federation truly natural over another one? The credibility.
Yeah, it's a really tough one because there is no such thing as a perfect test, and there's probably always ways to get around tests, and there's probably people at the cutting edge of pharmacology which are coming up with new substances which perhaps can't even be tested for just yet. But I would suggest that so long as you need to test on the day of the show. And test, I would say, all the winners as a minimum. It would be great if you could test everyone, but that's just going to be completely cost prohibitive. It would be fantastic if you could have external testing as well, off-season testing, because obviously these drugs have clearance times and you can take them for a while, and then as long as you stop taking them with the knowledge of their clearance rates and the knowledge of when the test is coming, they could potentially leave your system and you could test clean. So it would be great if there was off-season testing in addition to competition testing. It's just a very hard thing to police and regulate. There's probably privacy considerations involved. It's a very tricky thing, but in my opinion, the vast majority of the natural federations in Australia have been more based on an honour policy than anything else. I haven't seen a whole lot of drug testing. It has happened, but doesn't seem to be that commonplace. So we'll see what all the feds do. I know NPC Australia is very, very serious about their testing, and I know they've tested every single winner of every single division at their recent series of shows, and I happen to know, I don't know that Tony's announced it, but every single one of those tests did come back clean. So we'll see where it goes from there, and if other federations lift their game so that they can assure their athletes, at the very least, that everyone is natural on the day of the show.
And how do you feel about some federations that have a defined period where if you haven't been using performance-enhancing drugs, you can sit it out for between 3 to 5 years and then you can compete again? I think that is a terrible rule because you have lifelong advantages when you've been exposed to PEDs previously. That's my opinion. Like if I was to get back into bodybuilding now and say I'm going in a natural show, well, I'm going to have a very, very good response given the fact that I was trying to be as big as humanly possible as an IFBB pro bodybuilder. I see that as being extremely unfair, but it's a rule, and if you can work around it, go for it. But what's your opinion on that one, Scotty?
I think that rule's based out of the necessity of not being able to enforce anything else. Like you really can't go back and retroactively test people for what they did 5, 6, 8 years ago. So I think they've just sort of conceded defeat. But I'm with you. There are lifelong benefits. It's undoubted. It's proven. You can even see it when a man goes through puberty. There are certain physiological changes that take place which are permanent. And there's no way of reversing those things. And it's the same thing when you take your first dose of testosterone or supraphysiological androgen levels. So once you have used performance-enhancing drugs, certainly the ones of the AAS, the anabolic androgenic steroid category, then for me, you are no longer natural. And in my opinion, you should remain in the untested federations. But look, if the rules say otherwise, I reluctantly accept the rules.
What do you reckon, Scotty? We do a comeback, mate, and go in the Masters in one of the tested federations if we've been sitting out for a while?
Yeah, you could probably win, though. Look, it's a little bit embarrassing if I do that and then I lose. So I might leave that to you because I attended all of these natty NPC shows, and I tell you what, the guys are getting pretty good these days.
Nice. And look, most people, when they're thinking about, I guess, steroids, it's going to be the anabolic androgenic testosterone derivative. So your testosterone, your DECA, all those good compounds. And this is one area, I guess, that it can be sort of a bit difficult to get your head around. Something can be more anabolic, so more muscle building, and it has lower androgenic effects, but the overall anabolic effects are much lower than some of the compounds that are very androgenic, so the male secondary sex characteristics and, you know, the oily skin and the body hair, and you might get some pimples and some aggression. But those compounds have, even though the ratio of androgenic to anabolic, it's higher in androgenic, the overall anabolic effect as an absolute is a lot higher as well. And I guess that's what draws a lot of people to some of those really powerful compounds, in particular some of your oral compounds, because, you know, they're going to get the most muscle growth, but that also has the most potential for side effects. And, you know, there is a limit, with what your body can utilize. You've got androgen receptors all throughout your body, and the androgen receptors in your muscles, once they're saturated, so they've reached the maximum level that any anabolic androgenic steroids are going to have, after that, it just tends to be an increase in side effects. And those side effects can be fluid retention. And you hold more fluid, you're looking bigger. You hold more fluid, maybe you're a bit stronger in the gym. You've got a greater contractile strength. And so you associate higher and higher and higher doses with more muscle growth. But realistically, once you reach that androgen receptor saturation point, it's potentially just all side effects from there, and, you know, starts affecting things like your liver function, your heart health. You know, these effects start to spiral out of control, and a lot of people see that as the higher the dose, the more muscle growth. But essentially, it's going to be just a lot of fluid retention after a point.
Yeah. Look, there is a point of diminishing returns, and again, this seems to be linked to the individual. I've known people that can continue titrating their dosage up and seeing better and better results, and they can potentially do that on a higher total milligram load than their best mate and training partner, who might hit a threshold where they apparently receive no extra benefit and they only get additional side effects. So it is very independent how people process, eliminate, and respond to drugs. And I've spoken to doctors on this, and, you know, even anesthesiologists and things like that, that they will say, you know, you would think that this should put a person under for an hour and get them through their surgery, and then 20 minutes into it, they're suddenly waking up and you have to administer more. And it's the same sort of thing with this, you know, like you can have people which are hyper responders, and you can have people which respond really poorly, and you can have someone who can't really exceed a total milligram dosage of a male that can't really go above 750 total milligrams per week. And you can have another individual that can safely go to 2000 total milligrams per week without seeing an excessive amount of side effects. So yes, there's absolutely a threshold. And when you go beyond it, it's much more sides than it is additional benefits. Where that threshold is up to the individual. And that's where things get really, really sketchy, because you could have a bodybuilder advising someone else, and this particular person with not really any knowledge other than what they've applied to themselves could be recommending dosages which they can tolerate but others cannot. So it's always in your best interest to start relatively low and build up slowly, and maybe don't even build up if you're getting fantastic results. I've got some clients which I advise that will say, man, we're always so conservative with gear. And I'm like, well, you keep on growing on 600 milligrams. Why are we putting it up? Like, every time you respond and every time you put on lean muscle and every time you don't get side effects, we're not trying to get side effects. We're trying to get safe long-term growth. So it's a tricky subject when it comes to total dosages. And then sometimes the total dosage you can tolerate is dependent on the compounds you're applying. Within that AAS category, we've got your testosterone derivatives, your DHT derivatives, your 19-NORs, and they're all metabolized and processed down different enzymatic pathways. And as a consequence, you might only be able to have a total of 1,000 milligrams if all you're taking is testosterone derivatives. Maybe you can't even get to that, because that would be most likely to aromatize and cause issues. But maybe you could get to 1,400 milligrams if you had a combination of testosterone, DHT derivatives, and 19-NORs. And I know we said we're not discussing dosages, and I'm throwing all sorts of milligrams out there, but this is the reality of the situation. And sometimes I've known people which are new to the sport, and they'll go to a really good coach, and the really good coach will have them on multiple compounds. They'll have a small dose of test and a small dose of Masteron and a small dose of MPP and a little bit of growth hormone and a little bit of insulin and all. And they'll be like, oh my God, this is crazy. But in reality, you might actually be safer with that sort of approach than you would with just one or two higher dose compounds. So pharmacology is a very intricate topic. And the more you delve into it, me specifically, the more you realize you don't know. And you need to move forward with caution, because it can be a real minefield if you don't know what you're doing. And even more of a minefield if you don't know what you're taking.
And that's exactly right, Scotty. And I guess sometimes people might want to go for those more anabolic compounds because they have less of the androgenic side effects. So, for my first cycle, I'm just going to run some Anavar and maybe some Deca. The thing is, as soon as you put any of these anabolic steroids into your body, there is going to be a downregulation in your own natural testosterone. So your brain is going to pick up that, your estrogen levels are high, which means that your testosterone must be in overdrive, or it's picking up other compounds. And so your brain will signal to your testes to basically stop producing testosterone. Now, if you're just using a compound like Anavar or Deca, that is very, very problematic because you don't have those androgens, and you might actually find you're in one of those strange situations, especially running something like SARMs. If you're running some experimental SARMs, and I want to do it because there's less side effects, but SARMs are in the same category. They're going to cut out your body's natural testosterone. And so then you're in this unusual set of circumstances where you have some PEDs in your system, but it's not offsetting your natural testosterone. And so you're in a low testosterone state, feeling like shit, not getting good results. And I just see that as something is a very common question that I get asked all the time. Could I just run a cycle of Anavar or some SARMs and everything would be good? But they don't factor in the body's natural shutdown in testosterone production. If you're not offsetting that, you're going to be going backwards and feeling like crap.
Yeah, absolutely. And when you come off it, you're going to continue feeling like crap. And I've seen that as well with clients or with customers and things that have taken SARMs back in the sort of days where they were momentarily legal, and they did experience suppression, and as a consequence, when they came off, they felt worse than when they started. So it's a tricky subject, and it obviously differs from male to female athletes. Obviously the female athletes cannot go down the highly androgenic compound pathway, but yeah, for males, I guess I would say that for the vast majority of them, there should be a foundation of testosterone in place so that you just feel good. But I had a mate who did a Deca-only cycle, and he was probably clinically depressed for about week 4, I would say. Yeah.
Yeah.
Clinically depressed and impotent, which probably contributed to his ongoing depression.
It's a very bad combo, that. And I guess that's one other thing is the mental health aspects of playing around with your hormone profile as well. There can be ups and downs. You can feel absolutely amazing on PEDs. You can feel like absolute shit on PEDs. Coming off it can be problematic as well. And so then that leads us into my next question, Scotty. Blasting and cruising, running cycles, there's so much information out there. My overall take on it is this. If you can run the lowest dose to get the best result possible, go for it for the shortest period of time possible. And the only way to really confirm how you are going overall with your health markers is to get some detailed blood work and to make sure that you're staying on top of things in that way, because you can't go off feel. You might be have an amazing blood profile and metabolic profile, but you might be feeling like shit running the PEDs. The alternative too, you might be feeling amazing, but then you get some blood work and, liver values are out, cholesterol's out, your blood pressure's up. It's a bit of a minefield, but is that the most objective way to ensure that what you are doing is keeping you in a relatively healthy zone is blood work, and there's not really any other way around that?
I don't think there's any way around it, Luke. I think you've hit the nail on the head with that one. We do not know what's going on internally. Without that blood work, you can't just interpret changes metabolically, cardiovascularly by the exterior. You just can't. You might be able to look at someone and say, why is his head beet red and swollen? Perhaps he might have blood pressure issues, but that's still not an indicator that everything else is going okay apart from the blood pressure. So blood work's mandatory. If you're going to go down the PED route, you want to get blood work. You want to get blood work prior to going down the PED route so that you can establish some normal baseline levels for yourself. And it should be your goal to get back to those baseline levels when you come off. So I think it's very, very important. I tell all my clients that use PEDs, there is never a bad time for blood work. They'll quite often be like, oh, I don't want to take blood work now. I'm at full blast. Things are going to look bad. It's like, that's the point. You're meant to take it when things are bad, and you're meant to take it when things are good, because we want to see, some of the times when your blood work's all out of whack, that is a sign that you are changing the long-term projections for your cardiovascular health. And some of those things are largely irreversible. If you've got heightened blood sugar levels constantly because your growth hormone intake is through the roof, and you've got super high LDL and super low HDL, you probably are laying plaque on your arterial walls at that time. And while you might be able to alleviate some of those concerns when you come off or you reduce your dose and you go back on a cruise, if you're only testing, when you're 8 weeks into your cruise dose and you're not seeing these changes in your blood lipids as a result, you're unaware of the fact that you are still potentially shortening your lifespan. So get blood work at any time. It's always a good time for blood work.
And the blasting and cruising that you spoke about, that's a method where you're running a higher dose for a set period of time, and then you're coming back down to a very, very low dose while you're, off cycle, as opposed to coming off completely. Now, a lot of people might ask, what is the point of that? What is the point of staying on a very low dose of, say, testosterone and just have it around that maybe hormone replacement therapy or augmented sort of hormone replacement therapy level? One of the reasons is because if you come off, you're going to crash and your testosterone levels are going to be almost non-existent. Now, if you're not looking to run another cycle again in the near future, it's going to be in your best interest to try to get your natural testosterone levels back. And that's what's often known as your post-cycle therapy. However, if you are you're in a bodybuilding off season and you've just done a blast period and now you're looking at another blast period in maybe 6 weeks' time, like there's no point on running a very detailed post-cycle therapy. This is my opinion, because you're going to be introducing all of these new exotic compounds in, and you might get your natural testosterone back maybe in 6 weeks. Maybe you do, maybe you don't. But then you're just going to be blasting again. So, that's a consideration, I guess, for someone who is a very competitive bodybuilder looking to maximize what they can. The blast and the cruise may be a better option than, say, a blast and coming off completely and trying to reset your HTPA axis, because you're just going to stuff it up again.
Yeah, look, I completely agree. I would say most competitive bodybuilders are blasting and cruising as a general rule of thumb. The downside of that is obviously that fertility is going to be compromised. But outside of that, you should largely be able to restore most of your health markers if you are on a true cruise dose. And by that, I mean falling within the normal physiological ranges of testosterone and those androgenic hormones. If you're still exceeding those levels, because some people will trick themselves or con themselves into believing they're on a cruise dose when they're running 250 milligrams a week, and at that level, there is still generally aromatization taking place, maybe suppression of SHBG and a few other things going on which aren't exactly healthy. So I am of the opinion that blasting and cruising is very, very common, and as a general rule of thumb, probably the correct approach in competitive bodybuilding. There are some exceptions to that rule. If I'm perhaps coaching a 22-year-old, they've done their time, they've been training since they're 15, they've gone really hard, they're consistent, they're dedicated, they do their first cycle, I might just get them to come off and run a PCT, because as a general rule of thumb, they're young, it's their first cycle, they bounce back pretty damn fast, they don't experience more than a couple of week lull, and I think it's maybe just good to know that you can reboot your system. But once you've been going for a while and once you've vastly exceeded your own natural potential, I feel like when you come off, you lose so much of what you gained that it's just sometimes not in your best interest, and you need to keep that testosterone in the upper range of the normal levels in order to just hang on to the gains that you've made. So yeah, it depends on where you are in your drug taking career, and it probably depends on where you are in your lifespan as to how well you will bounce back. But I would say for the vast majority of people, inevitably you're going to have to come off at some point in time. So yeah, you better be ready for it. What goes up must come down at some point.
And mate, we've seen an explosion over the past 10 to 15 years of a whole new category of competitors, all these new female classes coming in. Now, this is something that I am way behind the eight ball on. I really am. I don't know a lot about females and PEDs, I'm going to be honest. But from my understanding, it's relatively common now, top level. If we're talking top level, non-tested federations, PED use is part of the fun now because of the high standard that has been set from the physique. So just if someone came to you, if a female came to you and said she was thinking of running PEDs, do you have do you have like a bare minimum that you would like to see from them? Training history, physique development. Like, do you have a standard at all, Scotty, where you would advise them, look, maybe get to this point first and then, see how you go?
I think the same rules apply to females as they do to males. So you better have a fantastic understanding and a really consistent few years behind you before you even consider it, because female athletes can achieve a good level of natural development as well. That's that in terms of, the physiques and our first definition of can you build a great physique without PEDs? Same applies to women as men. If you want a great physique compared to the average person on the street, absolutely, you do not need PEDs. If you want to have a great physique compared to, the wellness Miss Olympia, then unless you're like a 1 in a billion Brazilian lady, you are going to need PEDs. So it is common these days, and different considerations are applied to women. And I think there's a bit of a stigma around women taking steroids, and I'm kind of against it because they'll say, like women should never take male hormones. Well, women are the only ones that actually produce nandrolone. Men don't produce nandrolone, but women do in pregnancy. So why are men taking nandrolone, but women can't take testosterone when women actually produce testosterone? So look, in the females, the thing they're primarily trying to avoid, because typically they don't see the same cardiovascular risk just due to the dosages they can handle. They're trying to prevent virilization or the development of male sexual characteristics. The deeper voice, the hair growth, enlarged clitoris, all these sorts of things are the things they're trying to stay away from, obviously, to retain their femininity. And in those instances, they are looking much more at utilizing the highly anabolic, very low androgenic compounds. But you'll have women out there taking everything, and I would say in their case, as it is for men, the risk of side effects is dependent on not only the compound, but the dosage of the compound and the duration of exposure. So women can take testosterone, but whereas a man might take 500 milligrams a week, a woman might take 5 milligrams a week. And both would expect to see significant benefits from those sorts of very specific milligram dosages that we said we wouldn't apply at the start of the episode, Luke.
Well, look, there's a problem with that, Scotty. There's a problem, and that's because of the underground nature of the anabolic steroids. You don't know what you're getting. You have no idea what you're getting. And look, it's not like you can call up Fair Trading Australia and say, look, I was sold this product and it doesn't match what was on the label. Some people are out just to make a quick buck. Everyone will always say, oh, I've got these 250 glass vials and they come in a box. And anyway, 20 years ago, I was pointed to the person who in Sydney at the time was making this, and he was training in the gym that I happened to be at the time. And I saw him leave in a Ferrari, and he had a glass blowing equipment, in his backyard. And he was printing up the boxes, and these were snap lock vials. And this is 20 years ago, and he's driving around in a Ferrari. So, number one, the chances of being ripped off are extremely high because of the black market nature of what you're running. But the other thing too, there's no stringent sort of manufacturing protocols. So if, old Bob's mixing up a big batch of testosterone in his bathtub, he doesn't mix it properly. Some of those vials that he puts might be very well underdosed, even though Bob has the best intentions of making it up to a certain dose, because he hasn't, really got an appreciation of the best way to make it to keep everything nice and balanced and level. So it is a very, very, very big minefield. Another one, Scotty, is the good old blue top growth hormone vials from China. Who knows what was in that? I mean, there was a period of time where it was, it was HCG, I think it was, and you could test it with a pregnancy test, and you don't even know what the other fill is in there. It's probably just an innate substance that does nothing at all. But I mean, this is a very, very serious consideration, because the other side of the coin is some things can be extremely overdosed, like Bob's mixing it in his bathtub, and he pulls out a vial that has quite a lot of concentrated crystals in there, and it's triple the dose of what's on the label, or someone selling trenbolone, but it's just test propionate with a little bit of iodine in there to color it. So, but this is a genuine consideration. Like, nobody knows what they're getting. And from my sources, and we're talking Nick, the biochemist, who we're going to get on the show, he's pretty much said, like, everything is numbered and labeled from the pharmacy when it comes to these medications, your testosterone and things like that. And there's not just a truck of testosterone vials that's gone missing on the way to a pharmacy delivery. Everything's accounted for. So the old sort of story, I know exactly what it is because it's from my mate from the chemist. There's been many cases where chemists themselves have been making them underground and just selling their own products. So it's an absolute minefield. You can never be sure what you're getting.
You can never be sure, and if you do have the ability to test things, and you can, like there is labs that you can send things off to and get tested. The more you test, the more you will be depressed by what is actually out there. It's very, very concerning. So, yeah, all the, as a general rule of thumb, all the super potent testosterone 400, no, you can't actually get 400 milligrams of testosterone into 1 ml of liquid. The solubility will not allow it. Sorry, that's a lie. But the most concerning ones, especially for the female athletes, is that the highly anabolic, low androgenic compounds like the primobolins and anabars are easily substituted by the cheaper variations of testosterone and dianabol. And those are going to cause you a whole lot of issues. And I've known female clients to take Primo, and then 2 weeks later, they're 4 kilos heavier. They're a bloated mess. And they're getting all sorts of, skin breakouts and things like that. And it turns out they're not taking Primo, they're taking testosterone. And if you get caught out, serious things can happen. So it is not controlled at all. It is not a scrupulous industry. And under certain circumstances, it's not even the fault of the individual that's making the drugs, because he might have just sourced some incorrect raw ingredients. I've known people to order legitimate products for supplements, legal products for supplements, import them from China, a genuine exporter, think, this doesn't quite seem to work the way I thought it would, test it, and instead of some exotic stimulant, they've just been sent caffeine. So it is not unusual for the suppliers to just send you powdered testosterone in place of your primobolan or whatever it may be, because the way they see it, people will get results they'll never know. And 99% of the time, they're absolutely correct. So, yeah, it's a very, very sketchy industry when you look at it. And I've known individuals, I had one guy who was taking a drug stack of testosterone, Masteron, Primo, and Trenbolone, and we just wasn't responding the way we thought. His estrogen was through the roof. We send everything off to get tested, and he was taking testosterone, and testosterone. So it absolutely none of the compounds, with the exception of the testosterone, were what they said they were. So it's it's a minefield out there.
You know, Scotty, there's one compound that over a space of 20 years, I know at least 4, but potentially 5 people who had to go to hospital and get an abscess cut out, huge hole in the glute. I think all 4 of them in the glute. Massive hole that they had to go back to the hospital for every day to get changed. 2 of them were actually brothers, and they did it over the space of a couple of years. Can you imagine what their parents thought? But massive abscess for this one compound, time and time again. Do you know what it is, Scotty?
It would be stanozol, I imagine.
There you go,
water-based
mate.
stanozol.
The liquid stanner. And mate, I'm telling you, the stories they have told me from the open wounds that they needed to have are unbelievable. Like a full open wound, they couldn't close it up, going to the hospital every day for 2 weeks to get the dressing unchanged. It's on their ass. You know, they have to tell people about it. It would be terrible. But it's that one compound 4 times, maybe 5 even.
Yeah, look, I could add a handful of people to that tally as well. I think we could probably get ourselves. Oh, yeah. That stanozol's legendary for it. The old water-based veterinary compound or theoretical veterinary compound. I don't know what it was about it, but yeah, by far the most common abscess generator I've ever known. I was always terrified. I never used it, just due to the horror stories that I'd heard. So yeah, let's avoid that one. I think that's at the top.
Yep. And so, mate, if you wanted to get any PEDs legally prescribed, let's say testosterone, how do you feel about this, Scotty? If you're a male with low testosterone, you're going to pretty much get told you're a criminal and get out of the doctor's office. If you're a female who's looking to transition to become a male through testosterone therapy, you get it thrown at you and you get rewarded as a champion of society. Mate, that seems very, very crazy, stupid, unfair. What do you think about that?
Don't try and suck me into your transphobic rhetoric here, Luke. I don't want to get banned by the woke agenda.
Well, is it transphobic? I don't know. Is what I just said that a male trying to get testosterone and told no, like in no uncertain terms, but a female doing it, like, is that really anything other than craziness? Like, I'm open to you to talk about it.
No, it is craziness, because in both instances, low testosterone can have quite debilitating effects on male mental health. And if we're prescribing it for female mental health, then why can't we prescribe for male mental health? So absolutely, I'm on your side with this one. I just don't want to get cancelled. So I would say that, yeah, if it's beneficial, and there's plenty of evidence that does show that low testosterone is detrimental physiologically as well, there's a sweet spot. We know excess testosterone can cause cardiovascular risk increases, but so can low testosterone. So I would think if it is being utilised for a true medical purpose, both physical and mental, then and why aren't we applying it? Like, we do know there are benefits there. So yeah, there are some doctors which are more open-minded, I guess, but the vast majority do see it as just, I don't know, cheating, or I don't know what they see it as. It's just
it's crazy. It's crazy.
Yeah.
Should I speak the truth, Scotty? And I believe 100%, mate. If it's prescribed for a female with mental health problems, it should be given to a male with physiological problems. It's a bit of a no-brainer. But, mate, I think that pretty much will wrap up this episode before we get it taken off the air for many different reasons, whether it's my comments or your specific doses that we gave. But look, we want to, keep this channel as open to all discussions as possible, not shy away from anything. Hopefully, we've given a bit of a perspective that it's very, very nuanced when it comes to running PEDs. And, if you want a rock solid physique, if you want to be strong and healthy and fit, you certainly do not need to go down the road of PEDs. If you're looking to become the next Mr. Olympia on the IFBB stage, well, you might have to give it some consideration. But we're not telling you one way or the other. We're just trying to present as much factual information that we know of as possible so you can make your own informed decisions. Once again, Scotty, thanks for joining us on this week's episode. Thanks to Max's Protein for sponsoring Muscle TV. We appreciate you, Max's. Thank you very much. If you're liking this content, please leave a thumbs up. Don't forget to subscribe, put the bell on for notifications, and we'll be back next week.
There's no cure for this.